Good morning. Happy Monday. I'm only here for the next 5 minutes. I just wanted to do a quick intro to Parth and Nidhika on my team. Parth is the CEO and founder at Decode Age, and I'm very excited for this conversation because I've been waiting for something like this for a while. I want to know all about not just living longer, but living better. And I know Parth is going to help us with that. It's our mission to do that and just figure out the holy hack without doing Brian Johnson's 2 million protocols. So I'm going to let Nidhika take this session forward. Parth, thank you so much for being here with us. I really, really appreciate it. Miss Jen, if you can take it forward and just bring this home with a really nice session. Thank you.
Thank you so much, Anisha. Good morning, everyone. Welcome and thank you so much for joining us today. I'm Nidhika from Chi Capital and I'll be moderating today's Together Lab session. Before we begin, just a few housekeeping notes. Please keep yourself on mute through the session. That helps us keep the video clean for everyone. We'll have Parth take us through the conversation, and once we are done with our questions, we'll open up the floor for audience questions. If anything comes up while Parth is speaking, do feel free to type your questions into the chat as we go along and we'll pick them up at the end. Together Lab is She Capital's knowledge series where we bring our community into focused conversation with people working on what matters more. Today's topic is one that's quietly become one of the most important conversation in health science. We have spent decades focused on lifespan, as Anisha just said. How long we live is more important now. But the real question now is health span. How well we live, how sharp, energetic, and capable we stay through the years. And we couldn't have asked for a better person to take us through this conversation. We have joined today by Parth Amin, founder and CEO of Decode Age. Decode Age is one of the India's leading longevity science companies working on cellular interventions, biological age diagnostics, and science-led products built for the Indian consumer. Parth has been a quiet but important voice in helping India catch up to the global conversation on aging, and we're really excited to have him here with us. Parth, so glad to have you with us. We have got a great set of questions lined up for you today, covering everything from your own journey to where the science is headed. Let's start with the basics and go from there. Yes, Parth, you there?
Yes, Nidhika, I'm here.
Thank you.
Thank you so much for introducing the company.
Okay. Shall we start with a questionnaire round?
Absolutely.
I'm sure our audience will be excited to hear a lot from you and to know a lot about how this really matters to everybody. So to start, we had love for everyone to get to know a little. We want to know you a little. Could you tell us about your background and what first drew you into the world of longevity?
All right. So I'll give you a brief on myself. I became an entrepreneur in my early 20s. I built and scaled a telecom company called City Broadband. And before I got an exit in 2019. So I was always fascinated by solving these difficult problems, which not many people majorly enter into. So my longevity journey was not planned. Post this particular exit, I learned yoga, and during this period of learning and discovering yoga, I felt better with my health. Because I was struggling with chronic inflammations as well as more of fatigue and through my years into telecom. And when I was feeling better, I started understanding that what really matters here. I started learning Ayurveda. I started learning, getting Vedic knowledge. And even I thought of why not understand longevity science, what's prevailing in the Western nations, how modern science approach really helps into aging. And so during this particular journey, aging really came down as an opportunity there. And I was brought to majorly aging by one of my family friends, that is Darshit, and who is currently our co-founder. And he comes from a drug design background. He has done his metagenomics. He's a metagenomics specialist, and I would I would present him as he's a core obsessed person to science. Uh, I also met in this journey with Rakesh, who is currently a co-founder. He was living this particular longevity life, which we all wanted to, and which we really currently talking about. Uh, and we started discussing about what's happening and what kind of lifestyle changes are required, what kind of interventions do we need to improve my own health, but then it became to turn up to a company. Now we call Decode. So that's how our journey really started. And we founded Decode in 2021 with a mission of bringing healthy aging, making it more accessible, uh, making this science more accessible to everyone in India. And that was the aim. That's how we started. So, yes, that's how my journey looked like uh, till date.
Pretty interesting. And I mean, something I'm sure you would have not thought about it long before, right? So something
Absolutely.
all of a sudden it came through you. So nice to hear that. But there's a common criticism that we normally hear, which is longevity companies are selling hopes. So there's a lot of confusion between lifespan and health span. Since no one has really taken these supplements for the entire lifetime, I'm sure you will resonate with this thought also. How can you genuinely talk about longevity? Where does the science end and marketing begins?
That's a fair question to ask. And I think I've been getting these questions more often from investors out there whom we pitch constantly. But the first thing I would say is we don't claim that any supplement will make you live 100 or 120 years. Uh, and nobody can honestly make this claim because, as you said, these interventions haven't existed for 100 years today. What longevity science is really about is understanding biological processes that drives aging. Over last few decades, we have been learning more about human biology like never before. And we have learned a lot of things today from cellular aging, senescent cells, how our repair or uh, repair mechanism really works into our body. How can we reduce this damages which comes by aging? All this different particular things really came in recent time, but we have been talking about aging since 150 BC, because the first people to talk about was Aristotle. I'll be sharing I'm writing over those the entire history of aging, and I'm going through this particular history of aging, and we have been talking since ages about how we can improve our healthy aging journey. So I believe that we should not be selling. We should not be overhyped with living longer, but the longevity really means, can we live healthier, more energetic uh, till the day we really live? That's something what longevity really should mean. And science is always humble. So we follow evidence. We are very transparent of what we know and what we don't. And we are very happy to change our views with more new researches coming and getting emerged every particular day. So longevity intervention should not be viewed with the same way. The evidence uh, the tools which are currently available to really understand biology, we should always go through those particular interventions and not look at pills like a magic pill.
Got it, very rightly said, actually. But when people see someone like Bryan Johnson spending millions of dollars on longevity, it can feel unattainable, right, to a common man. So, how much of living longer actually requires money, and how much comes down to everyday's habit?
It is very important for everyone to go through. That's the most important thing which you should do. I generally talk about this in a way that if I don't want to see everything perfect. For longevity, you need to start. And no one needs to be Bryan Johnson. He's doing an amazing job of telling us that what's possible, right? What we can definitely do is we can take a breakfast exercise, what I say, because we have been working for a longer period of time. We have been not moving, and we always want to do this exercise for 1 hour, and we always believe that we have to do 1 hour of exercise. We always talk about doing everything perfect, but that's not possible. And what you should really think about is thinking positive of how well you can stand. Making a routine which is perfect for every day. You can follow those particular routines. Something what you can do is you can take a break for even 5-10 minutes. You do squats near to your bench where you are sitting. Go for a walk, take stairs, talk to someone. All those small practices really help you live a better life. And that's something what you require for every particular day. And consistency is something what I always believe in. A lot of
Right.
people say that can I achieve or can I beat aging within weeks? No, you cannot. Or month, you cannot. It's something what has been damaged for years or decades, and you want to repair it, or you want to focus and you want to work on it within few days. It is not possible.
So basically, it is more about discipline and not so much about money, right? So sometimes people do have these kind of misconception when I said Bryan Johnson spending millions of dollars on longevity. So you're absolutely right. Discipline is something which is one of the most important factors to achieve where we want to. So now for people who are just starting to take longevity seriously, what are some of those common mistakes they tend to make early on? I'm sure you had just mentioned in your last uh, we were just talking about that people think that something that we do should give us quick responses to that, right? The results should come soon. So I'm sure one of the common mistakes are there, but you can talk about more commonly mistakes that people are really doing early on when adapting to this thought seriously.
I think one of the biggest mistake is what I mentioned. People are not persistent.
Correct.
They are not consistent in doing
Consistent.
any particular one thing which they start. They tend to follow trends. So if there is something new, some new biohacking or some new pill coming in the space, everyone wants to take that and they stop following the current thing which they are doing. That's the biggest particular misconception, I think, which we should be really focusing on. We should be persistent and consistent in this particular area. Uh, One of the things which I constantly hear from people is, can we really slow down aging? And this is something where you should really understand is your aim should not be living forever, but your aim should be living healthier for the days you are really focused on living. Uh, that's what I say today to everyone.
So many people in our community run on long hours, broken sleep, chronic stress for years on end, right? What does the science actually say about the cost of that on the body and how much of it is recoverable?
So, we think that working late, like we do, working late and not focusing on sleep, not focusing on uh, improving nutrition, stress, and everything can really make us achieve something. But uh, that really takes a toll on your uh, chronic inflammation, because your inflammation goes up if you don't sleep well. Your immune system goes haywire. Uh, your metabolism gets bad in shape. Your cognition really takes a toll. Hormonal changes and many different particular things goes disrupted. Now it also impacts, because of all this particular thing, it impacts how fast you are biologically aging. Now one of the remarkable thing is our body really works well in terms of recovery. Our body can be at its best once you start improving some of those particular things. You start sleeping better. You start eating regularly at times. You start eating well. Uh, your improve your stress, meditate well. So if you start some of those particular practices, you your body will start recovering faster. You will start seeing that all of those particular other signs of inflammations or metabolic health, your cardiovascular functions would improve. And all these biomarkers, you can definitely track it into your blood markers or your health uh, trackers, which you generally use, Whoop or whatever tracking devices which you use. You will start seeing that those particular things starts improving in this particular area. Uh, I don't think longevity is all about doing extraordinary thing. It is about respecting our current biology we have evolved with. So if you're consistent on sleep timings, very important. Moving your body, doing exercise, uh, eating good food, highly nutrition-based food, I think you are done. And any particular interventions which really are evolving into healthy aging space, that's what you want in general to
So
improve.
basically, you have also answered my next question now. So my next question was to this only, that most founders today sit in front of the screens for 10 plus hours a day, right? And they barely. So what are those cheat codes that they can do every day, right? And you have just mentioned that at least have something in nutrition, focus on your sleep. So they should not compromise on that. So this is something that they can barely look at it. So we'll come to the next one now. So you run a supplement company, right? So let me ask a uncomfortable question. If someone has a limited budget, should they spend it on supplements, or there are other interventions that would deliver a bigger return on health?
I would I would not sell supplement there. One, I would say first fix your basics. As I mentioned in the previous question too,
Yeah.
improve your sleep, improve your diet, fix your daily habits, fix your movements every particular day. This is one of the things which you can definitely do. If this is not fixed, not any of the supplements will really work. So the cheat codes are fixing your sleep, fixing your exercise for daily. You should not focus on doing 1 hour of exercise. You should be focused on keeping momentum across your day. That's also very important for your healthy aging journey. So I feel these are few particular things you can do without supplements. And once you are there, your basics are complete. You can start with the fundamental supplements, which are D3, B12, omegas, uh, and magnesium. These are a few particular core supplements where you can start with and slowly move to how you can improve and how you really want to get in.
Yeah, so this actually gives me a curiosity to know about one more thing. So magnesium has become one of the most talked about supplements in the longevity space right now, right? So what does it actually do? Why is it having this moment, and how should someone think about whether they need it?
Interesting. I had this particular issue of waking up at 3 a.m. most of my nights before 3 years, where I discussed with Rakesh and we started. So he mentioned of why not starting magnesium. I wasn't taking any magnesium supplements before 2.5 years now, uh, and I got magnesium supplement, and it really gave me a good deep sleep for the longest night. Now, I always thought of that I would be overthinking or I would be constantly thinking. That's how I was waking up at night, but it wasn't. So magnesium is something which is involved into more than 300 biochemical processes in our body itself. It helps into energy production, it helps into muscle function, it helps into uh, uh, neural health, heart health, and improving your stress and sleep. So that's how the magnesium is majorly looked upon. It's not doing one thing. And every form of today's the biggest misconception with magnesium is, should I take only magnesium glycinate? Should I only take magnesium threonate? Because every particular different form of magnesium really works on different functions of your body. You really need magnesium, but your entire body requires magnesium. Bisglycinate focuses on sleep and relaxations. Your magnesium oxide helps with more of digestive processes, your energy production, your immune health. Orate and citrate really functions on recoveries and more on metabolism. Taurate focuses on our nervous system. So every particular different form focuses on different particular target of your body, right? And every particular process requires magnesium there. Now, one of the examples I see, I've been talking to one of the functional medicine doctors, and they said that, and I've learned recently itself, vitamin D3 is one of the things which we believe that taking vitamin D3 would fix the D3 levels in our body. But with one of the patients, they had magnesium deficiency. Taking vitamin D3 does not convert directly to D3 in our body. It needs magnesium to get D3 activated for our body through some of the enzymes involved in converting D3 in liver and kidney. So I think if we are taking D3, it does not mean you're taking D3 directly. Your magnesium is required to convert D3 to D3 in your body. That's something what I've learned recently, but that's how there are many particular processes where magnesium is really helpful and you require a full spectrum of magnesium in your body. And that's where we have also launched Mag 7 with 7 different forms of magnesium uh, in our portfolio. That's almost 1.5 years now and have been doing
Yeah,
very.
I mean, it is very surprising for me to also know about magnesium. I knew it is important, but I didn't know that it has so many roles to perform in our body. So I'm sure our audiences would also understand how important this magnesium is beyond even what we had always thought of. So now most longevity research has historically been done on men, right? But aging unfolds quite differently for women. How should someone think about longevity differently as a woman versus a man? And what should women specifically be paying attention to? We have been also seeing women taking, I mean, they have been asked to take supplements which are a little different from men also for their aging process also. We see some advertisements also coming into the TVs and newspapers about focusing especially on women. So what do you think about this?
Uh, I think uh, it has been majorly done on men, but today we see that a lot of the researchers are now taking women into major consideration because they have very little data, and they want to improve the number of researchers there also. So there is no bias today, right? And we have seen few very interesting studies where I personally talk to many of the women where uh, they generally talk about how can I start what can I start with in general. And these are more of people in the age of 40s who are going through premenopausal conditions or menopausal conditions. Uh, so I always encourage you to one, focus on your muscles because that's something which you start losing. Most of the women goes through osteoporosis uh, and they tend to lose muscles. So that's something what I would really urge to start strength training as soon as possible. Start your routines with the same. Second is more of hormonal changes which they go through during this particular premenopausal and menopausal conditions, where there is high heart or cardiovascular disease, which can come through your insulin resistance goes up and down, bones get weak, and that's where you really want to focus on some of the supplements, which really focuses on your menopausal conditions. You should not wait for these conditions to come in. Third is most of the women have been lacking this particular core nutritions like iron, vitamin D3, magnesium, B12, omegas. I think this is something what you really have to pay attention. Go and do your blood works and start doing this particular uh, uh, getting this particular nutrition in your daily life. Also, one thing which recently we have been looking into is microbiome. I think women should do microbiome test once a year. I think many hormonal changeovers, your immunity and inflammations are really uh, important markers to look in, and microbiome can give you a very clear picture of it. You can really improve your gut health, your hormonal health, your mood swings with
Yes.
understanding your microbiome and changing your diets out there.
This is something which is very insightful. I think audience should actually note this particular test for the females in their family, or if you're hearing yourself. So that's something very important, and I personally take it to myself now. So, how is India, according to you, approaching the longevity conversation compared to the West? And where might we actually need a different playbook of our own?
I think India has 100 India in one particular nation. So India can is always looked upon in a different way in terms of health, longevity, or any of the research which happens. Something which is proven in Western nation does not mean it will really it works in India. Because I'll give you a short example. So some of the bacteria which are probiotics which are healthy for US citizens or US people are are currently considered to be unhealthy for Indians. Now, this sort of interesting understanding, if we get to know that how we really function. And in India, we also see that microbiome or a lot of markers changes across every city, every particular state, and we have been more diverse than any of the single nation out there because we have been eating differently, we have been living in different particular climates, atmosphere, we live a different life. So it really impacts overall on the research of longevity in India. And I think today we see great initiatives like Bharat Microbiome Study, Longevity India Project, collecting different particular biomarkers across India, understanding how diverse we are and which particular areas of the country that's where we are collecting more data to understand our biology and improve longevity going forward. So yes, India is making its own mark out there, and I believe there would be companies in the coming time who will take longevity from India to global.
Nice. We expect the same from you too, Parth. So, and to close this, if everyone in this room could leave with just one takeaway from today's conversation, what would you want it to be?
I think longevity isn't about living forever. It's about giving yourself the best chance to live younger, longer, and more healthier. And the best time to start is today. So I think take those particular steps. Be healthy for next decade because a lot of exciting science is coming around. Make sure that you don't get those stupid disease, any particular chronic conditions within this particular period. Try to avoid, try to prevent those because I do believe we'll be living healthier, longer life from today.
I'm sure. Thank you so much, Parth. That was such a rich conversation, so many things to sit with. So before we wrap up, I had loved to open up the floor to the room. I can see a lot of queries coming for you already by now, but if there are other people who are waiting for the conversation to get over, they can put their questions there in the chat box. We are now going to start with some of the queries that our audience definitely want to ask Parth. So Parth, I'll just open it up, the chat box, and from there I'll just ask you some of the queries that I can see our audience has started putting up. 1 second. So there's a first question. So we do not have the name, we just have the mobile being visible there. If we take, so from RR, if we take liposomal NMN 500 plus, urolithin A plus, and spermidine daily basis, can we expect after 6 months we get some changes on skin glow and elasticity?
Absolutely. I think NMN really helps you improve your elasticity of your skin. It helps you improve many of those particular processes. But it's not only taking supplement will improve your skin. As I always mention, you need to take care of the other things which you need to fix on. Spermidine has been helping improving your hair and nails. So not major effects you will see on skin, but yes, with NMN, definitely.
And 6 months is a good enough time to see some differences
Absolutely.
starting to come in. Right. Aman has written that if you had to pick just one biomarker or health metrics that most people should start tracking in their 30s, what would it be and why?
It's sleep. Sleep. The number one thing which I would pick is sleep. The second is nutrition, the food I eat, because how and what I eat is also very important. I majorly do intermittent fasting. That's something which really helped me improve on my daily life, being more energetic, being more focused across my days. Uh, that's something which really helped me. So number one would be sleep, because improving your sleep is efficient for your recoveries, everyday recoveries, improve your cognition, uh, and then it comes on food.
Nice, I'm sure, well answered. So we have a question from Puneet. How you message your health? How you measure your health? In what way, like what is health for you in terms of healthy people whom you're up to? Follow which person?
I follow Rakesh, so I don't. I always believe that improve 1% every day. Let's not improve 100% within a day and then forget to go back, or keep consistent on those particular growth. So let's improve 1%. Can I make any particular decision today on improving my health and then follow it for the longest period of time? Can I take those decisions? Can I improve my schedules in a way so that I can keep it consistent? So if I have to make any particular thing, I would generally practice on creating those particular protocols which I can follow for the longer period of time.
Nice. Uh, so we have Swayam Mishra writing to us. Since Decode Age is specifically built for Indian consumer, what's one thing you had to completely rethink from Western longevity science to make it work here?
I think we are reworking on building microbiome science for India. Uh, that's where we believe that something which has worked in Western countries will not work in India. And we have been uh, really working on improving markers, understanding the science of microbiome. We will be coming up with vaginal microbiome, oral microbiome, skin microbiome. These are few particular avenues where we are also working in. And it's really interesting to see different insights there. So I think we will be majorly focused on microbiome science in terms of our research and projects. But most of the supplements are well studied across, not only in India, but across the globe. So there is evolved science already there.
I'm very happy to see that a lot of audiences have so many questions and they're so particular about their health now. So that's a very good sign, Parth, for all of us in India also that people are considering this as a serious thing. So we have a next question coming from Gopal. No, actually Mohit. Does the future of longevity lie in discovering new medicines or in using AI to make existing medicines more precise? Very nice question, Mohit.
Mohit, I think we have to work on both of this particular thing. One is current particular science really has been evolved in terms of uh, what we know today, and how really this particular new modern science supplements work on our biology. But there are great particular researchers now going around and have been building AI-based longevity drugs, and we'll see this particular wave coming probably in next 5 years, where we'll be ultra personalizing the molecules. Even I believe that we will have less medicines, but having our gene edited towards reversing our biological age, which is into a pipeline and research out there. So Many more research, but still a way to go, not today.
Okay, so our next question is from Gopal. I find Decode supplement a bit on a higher price compared to peer companies. Can you work on it?
Absolutely. I think you should look at our trend so far. When we started, we used to sell this NMN at around 7,000, 6,500 rupees per month. Now we have brought it down to almost 1,700 rupees of the same particular product. And I think it has been 4 years now. Using the right set of ingredients uh, into supplements are expensive because not everything really works. It's more about quality, it's more about what's proven, and we want to source those particular right molecules. So, right molecules comes with price, and that's where our price for any particular supplements are higher because we don't compromise on those particular quality. We don't want to sell you any particular supplement, but we want to make sure that we sell you the right supplement which you require. I think once it reaches mass, once it reaches the mainstream, currently longevity is not into mainstream. It's more of in the top, probably 0.5% of the consumer base. And once it gets more mainstream, I think it will start getting affordable and start improving on terms of the pricing which you see.
Okay, so the next question is from Shubham. Is there any tool where we can find which product will work for me? I wanted to buy for my mom, but couldn't find one.
Is there any tool? I think blood markers is something what you can start with understanding. That's the easiest tool available to start any of the supplements. Check basic markers, your hormonal D3,
Okay.
B12, iron, magnesium, and basics of all these particular things will really help you take this first step into supplements. Uh, Once you are there, I think we have more particular supplements which are NMN, or you can start with transresveratrol, CAKG, which have been really working well on the biology. We cannot currently track NAD plus in India, but that's something where we are working, where you will be able to track your NAD plus levels very soon.
So we have next question from Nivedita. Is it okay to take magnesium every day or should I take a break from?
I generally follow the supplements in a way. So I take it entire week. I have been taking most of my supplements since last 3 or 4 years now. Uh, and I do take a break of supplements every Sunday, and that really helps to break this particular barrier. But I have been taking most of the supplements since a long time, and it's very necessary because magnesium, when you talk about magnesium, I think magnesium is used overall in our body when we take over coffee or we drink coffee. Magnesium is being used. Uh, your minerals are being taken out. So you need magnesium every single day. If you are stressed, your magnesium is being used. If your sleeps are disturbed, your magnesium is being used. So in a lot of particular places, your magnesium is needed, and you should take it every particular day. But do blood markers if you really feel any particular changes, or if you're feeling not well. Do blood marker tests where you check your magnesium levels in your body, and then take those particular decisions.
So very relevant questions which are coming. So the next question comes from Ashish Jain. What is your take on apigenin and glycine as sleep supporting supplements?
Interestingly, glycine is well researched to improve your sleep. And I think in our next particular product, we have already introduced glycine, and you'll find it, it's a very interesting product which we are launching, and it's a protocol in itself. So we'll have blood marker tests, we'll have microbiome, we'll have the supplements which covers most of those particular necessary things which you require. So that's something what we'll be bringing, and it's essential. I think I have my take on it.
So there's so one more question coming from Puneet again. I think it is. So Parth, sir, what do you eat in a day? Is it same for every day? How much workout you do in a week? How much protein you prefer in a day?
Okay. So on a daily basis, if I'm in Bangalore, I have salads probably every day. The same salads I have been eating since last 4 years, uh, from the day I'm in Bangalore, because that have been a norm. And most of our people in Decode age, they generally tend to uh, get into salads. Uh, so this is something which is constant for me in Bangalore. When I go to home, I think I generally tend not to follow all those particular things, because I eat chapatis and every particular other things at home. Now, on the other side, I think my second diet, so I do only take two diets. One is salad during around 1 p.m., and one full meal with carbs and every particular thing at night. So these are particular two meals for me in my entire day. Uh, this Can you repeat what was the second
Yeah,
particular?
how much workout you do in a week and
I
how
do
much
every
protein you
day.
prefer?
I hit exercise every day. Not every day, but 3 times a week, and 3 times I do yoga. I practice meditation every particular morning, and even at night. For at night, I practice breathing uh, exercise for approximately 5-10 minutes. This is something what I generally do. Protein, around 30 grams probably in a day extra, because I have been eating eggs around, but I feel my entire day of food really covers my protein today.
Nice. So we have got Kiran Yadav asking, what's one health trend people are spending too much time or money on today?
One health trend.
Trend, yeah. People are spending too much time or money on today.
I think people are people are trying to do everything. They want to be on the trend wave, and they are investing. I've seen many people investing into 100 things probably in a year. Uh, the the current particular wave, which I see, the longevity centers which are coming across, I think this is one of the things which they have been investing into IVs. So that's something what I believe, which is not a true science, and which people are really spending their time and energy and money in getting this expensive IV trips where they can, which are not proven mostly. So I think that's something what I see as a trend which people are mad at, but which really does not work.
Okay, so from Arpan, do you have provision of doing tests to check whether any of the supplements is required, or what is the need of body and in which quantity?
Uh, we are coming up with blood markers which can help you. So we did had this particular test previously. Now we were working for a longer period of time to understand how really Indian biology functions out there. We did not have markers. We did not have capacity to really focus on research for the blood markers. But I think soon we'll be bringing this particular test where you can take and you can really understand what really works. But on a basic level, you can go to any of the companies of Tata 1mg or Orange Health or any of the companies and take a blood marker, a basic first layer full body blood marker test, and you would find a lot of insights out there. Also, you can feed this particular reports to your GPTs, which you've trained, which you're working around on. I think you can definitely get a lot of insights from there itself and take those particular first layer of decisions. Do consult any particular practitioner which you really want to, and I would prefer going to a functional medicine doctors because they really work on preventive care out there.
Okay, so now because of the time constraint, we'll just take up one or two more questions. That's it, and we'll wind up there. So there is one more question. Can we achieve autography effect by your supplements, which is NMN plus urolithin and Spermidine, if I have spelled it correctly?
So I think this is a misspelled. It is autophagy, if I am correct. You can achieve autophagy with Spermidine because that's something where Spermidine has been majorly proven. And you don't require almost every particular supplement for autophagy. But NMN helps you. If you take NMN with Spermidine, it really improves the effect of it.
Okay, so Parth, thank you so much for such a grounded and thoughtful conversation. So much to take away from this. To everyone joining today, thank you for being a part of this Together Lab session. This was hosted in collaboration with Decode. If you had liked to stay connected with Parth and work Decode is doing, we are dropping their social handles in the chat along with She Capital so that you can follow along. So we are also dropping a community link in the chat along with She Capitals. You can follow that also. So we also wanted to share something else with this room. She Capital runs a community exclusively for women founders where we share resources, grants, events, and opportunities. We're dropping the link in the chat as well. Do check it out if it sounds interesting, like something you had find it useful. Do keep an eye out for the next Together Lab session coming up. Thank you everyone for joining us today. Have a great day.